Greetings again. It's a pleasure to be here. I'd like to introduce to us, while we wait for the keynote speaker, Her Excellency, the Honorable Minister of Health and Population Egypt. Dr. Ogwell, it's a privilege to have you here, please. Thank you.
Thank you very much, RBC, and it is really an honor to be part of this first African Patients Congress as organized by the International Alliance of Patients Organizations. And at Africa CDC, we congratulate you and I wish you to have many, many more successful congresses in the future, not just for Africa, but for other regions as well as globally. It's also an honor to be invited to speak at this session and share some of our thoughts as Africa CDC around the issues of tackling health emergency situations on the continent, different types of health diseases on the continent, indeed, how we can be able to think into the future so that we can have better preparation and better ways of tackling some of the challenges that face us within the health sector on the continent. The session today has a very interesting theme, and that is if Africa can be the first to eliminate and even eradicate all infectious diseases by 2030. Now, 2030 is just under a decade away, some 8-9 years or thereabout will be in 2030. And therefore, this is quite a significant challenge. But the simple answer is yes, it is possible to control infectious diseases to levels that are not a public health emergency or a health security threat on the continent. Completely eradicating infectious diseases is something that we cannot be able to do. All these bacteria and viruses and different types of pathogens live with us in the world, and completely removing them may be a challenge, but bringing them under control so that they are not posing a significant threat to our public health and indeed to our health system is something that I very loudly say, yes, we can be able to do. Now, let me speak to why I say that we can be able to do this. As you know, our continent is a continent of syndemics. This is multiple outbreaks of different health conditions are happening around the continent all the time. In fact, today, we are all speaking about COVID, but there are 6 other outbreaks that are significant on the continent that are also happening. But not too much attention is given to it, not by the media, and certainly not by many of us as public health workers. So Africa is regularly visited by outbreaks which need our intervention on the continent, indeed globally. Also, when you look at the African continent, most of the countries do not have what we will say are efficient healthcare systems, resilient healthcare systems. And this means that it is a challenge to be able to address some of these diseases, whether they're infectious or otherwise, that are spreading across the continent. Now, let me step back a bit and say, throughout the time when we are faced with different outbreaks on the continent, whether it is Ebola, it is cholera, Rift Valley fever, monkeypox, and Lassa fever has visited us recently. Whenever we are faced with any health outbreak on the continent, we learn lessons. And we have been putting those lessons to good use. And that is why during this season of COVID-19, as the continent, we have responded far better than anybody expected us to respond. We have brought the numbers to very manageable levels, far better than anyone had predicted would happen on the continent. And this is because we are putting the lessons to good use. So here are a few lessons that we have learned and which we can be able to use to control, indeed eliminate some of the infectious diseases that are a threat to our health security on the continent. The first is that we need to coordinate our work across the continent. And coordination needs to be at 3 levels. First is the technical level. And under COVID, as Africa CDC, we put together the African Task Force on Coronavirus, and that task force has been meeting every Tuesday afternoon. Well, now we are changing that to be twice a month and not every week. But that technical level coordination has made sure that technical guidance documents that are being developed by our countries are all based on the same principles, and it becomes easier for us to harmonize what we are doing across the continent. So this is the first level, the technical level. Second is we need to coordinate at the governmental level. This is policy making, whether it is ministers, whether it is our heads of states. We need to make that coordination happen. And during this season of the pandemic on COVID-19, as Africa CDC, we have been provided with an opportunity to continuously be updating our ministers, our ambassadors, and our heads of states on the situation on the continent and giving advice on what steps we need to take to bring COVID-19 under control. And this has worked very well. We have seen a lot of solidarity on the continent. We have seen regions and neighbors coming together to be able to tackle any spike in the numbers. We have seen the whole continent provide us as Africa CDC and the Africa Union with good support so that we are able to do to meet our mandate even better. The third level of coordination is with partners. And this is where Africa CDC comes in. The lessons we learned during the Ebola crisis in West Africa was clear that we needed a specialized agency on the continent to be able to coordinate response. And one very key aspect of that response is coordinating partners. And we have many people interested in supporting Africa. We have many institutions and organizations. And if they are not coordinated, then there'll be no synergy. And if there is no synergy, there cannot be efficient delivery of response activities on the continent. So at partner level, we need to also get that going very well. So there's one key lesson we learned, that coordination needs to happen efficiently across the continent and across different sectors and across different stakeholders and players. And if we do that with all other infectious diseases, we will be successful in bringing these different disease conditions under control. So this is one. The second thing that we need to do so that we are able to ensure that we control our any disease threats on the continent efficiently is we must change the way that public health is practiced. We must change the way that public health response is delivered on the continent. We must change the way in which we prepare ourselves and engage with the rest of the world. And that is why, as Africa CDC, we are saying that in this 21st century, we must change the public health order. And that is why we have proposed a new public health order, which has 4 pillars. And these pillars, if we efficiently address them, implement them, it will result in all these infectious diseases being quickly addressed and not being a significant threat on the continent. The 4 pillars for the Africa CDC's new public health order are like this. The first is we must strengthen our public health institutions and healthcare systems on the continent. And we must do this at the continental level. We do it at the sub-regional level, and we do it at the national level as well. At the continental level, institutions like the Africa CDC, institutions like the Africa Union Development Agency, AUDA, NEPAD, institutions like the one that the treaty that is currently being ratified, the Africa Medicines Agency, All these need to be strengthened so that they can be able to deliver on their mandate efficiently. And when they do, the member states are going to benefit. So at sub-regional level, we have our regional economic blocks, some of whom have public health mandates and therefore are driving public health agenda. We need to strengthen those, whether it is the West African Health Organization, for example, or it is the Southern Africa Development Community Health Desk, or the East African Community Health Desk, or the Central African Community Health Desk. We need to strengthen these sub-regional organizations so that they're able to coordinate what is happening at country level. And finally, at the country level, we need to strengthen the national CDCs, or the National Public Health Institutes, as they are also called, to be able to tackle issues of public health importance at the national level. So that is the first pillar: strengthening public health institutions and healthcare systems on the continent. The second pillar is strengthening public health workforce, that irrespective of how much you know, irrespective of how many tools you have at your disposal, if you don't have well-trained, well-motivated, and passionate healthcare workers to be able to deliver on those instruments, then you cannot be able to get success. So we strongly believe that it is time to assess and reassess our public health workforce on the continent and see what gaps we have, and we fill those gaps with appropriate training that are adapted to our continent, and we fill those gaps with sustainable numbers and types of cadres of health workforce on the continent. For example, today, disease intelligence officers, otherwise known as epidemiologists, we usually say that we need about one for every 200,000 citizens. On the continent today, we are about 1.3 billion, which means that we need about 6,500 or thereabout epidemiologists in full-time employment and work. Today, we have barely over 2,000, which means that the gap of 4,000 to 4,500 is still very much there, and we need to fill that gap. So that's the second pillar: strengthening public health workforce. Third is we must become as close to self-sustainable as possible where health products are concerned, whether it is diagnostics, whether it is therapeutics, whether it is vaccines, whether it is accessories. We need to ensure that we are manufacturing our own products here on the continent, so that anytime there is a major force majeure or something big like a pandemic happens, our supply chain is not interrupted, and therefore we do not become vulnerable to different types of nationalisms that are going on today on the continent or in the world as a result of COVID-19 vaccines. We must expand our manufacturing capacity for vaccines, for diagnostics, for therapeutics, and for other health products. This is the third pillar of our new Africa CDC's new public health order. Finally, we must build partnerships, but those partnerships must have two very important characteristics. They must be respectful and they must be action-oriented. Respectful of our priorities on the continent and action-oriented, so we don't have partnerships that are self-perpetuating and not addressing the real need. They must have action attached to it, because it is only through action that we can be able to get results. So these four pillars define the Africa CDC's new public health order. And if we implement these four pillars, we can, will, should be able to ensure that all infectious diseases on the continent are brought under control, and those that we can be able to eradicate, we quickly eradicate, and Africa becomes a healthier continent. Finally, I would like to end my today's presentation with three messages. The first message is that Africa is able to handle its own health security agenda. And under this agenda will be all the infectious diseases that cause a lot of public health problems on the continent. So Africa can. All it needs are true partners who are going to be addressing the real needs on the continent. Second is that Africa CDC was born out of the Ebola crisis in West Africa in 2014 to 2016. And now we have become the coordinator for public health emergency issues on the continent. Africa CDC is growing, and today it is very much in place to be able to coordinate all these activities that are intended to address our public health priorities on the continent, including eradicating infectious diseases in Africa. So Africa CDC is not only present, but we are also ready and able to meet our mandate effectively. The final message I'll have to you today is that partners are required, and all range of partners. Indeed, this International Association of Patients Organizations is an extremely valuable partner because it represents those for whom the healthcare system has either failed or those for whom the healthcare system is a very key part of their survival, indeed, a comfortable living. If we don't have healthcare systems that respond to patient needs, if we don't have healthcare systems that address the real challenges that are faced by those who undergo one kind of disease situation or another, then that healthcare system is not effective, however expensive it may be. We need healthcare systems that are sensitive to and address the real priorities of their clients, and those are the people who have suffered in one way or the other as patients and as immediately affected people who are looking after those who may be unwell. So I thank you very much for inviting Africa CDC to this session today, and we look forward to strengthening our partnership and relationship with the International Alliance of Patients Organization. Thank you.
PC, over to you.
Thank you very much, Dr. Ahmed Ogwell. It's been a privilege listening to you. You gave us a quick overview of what the Africa CDC does, and you started by taking us through what has happened in Africa, the challenges that Africa has had in the past with healthcare, and how Africa has responded. And then you took us through how some of the lessons learned have been put together to help to face the current pandemic. And so with these novel viruses, we are using a blend of the experience from the past and the newer things we're learning. And then you went on to talk about 3 major lessons we've learned, and then 3 levels of intervention that we need, which has to do with coordination. And you talked about ensuring that there's solidarity, collaboration, and overall oneness. And then you also talked about the institutional support and the importance of synergies and partnerships. And emphasize that there definitely has to be efficiency to have impact. And you eventually summarized by talking about the 4 pillars for the sustenance of this leadership that we intend to get in Africa, in the health system. And the 4 pillars are centered around public health, the public health affiliations and structures, and then the public health workers themselves, and of course, supporting and enlarging an institution like the Africa CDC that is always there to respond to public health emergencies on the continent. Thank you very much. It's been a privilege listening to you, and we believe that the continent has quite a lot to give. Although I would have, since you are the respondent, sir, we would have wanted you to tell us whether Africa would lead or not. But maybe you don't want to preempt Her Excellency in answering that question. So we would leave it off for now while we await Her Excellency's speech. Thank you very much once more.